point, but before that, let me introduce myself a little bit. Okay, I'm Dr. Wan Hasliza from Kuliah of Nursing. Okay, so my background education, which is have master in medical statistics. I'm considered one of the statistician at the Kuliah of Nursing. All right. Okay. All right. Let us start. All right. Mhm. Okay, all right. Okay. So our topic today is planning of statistical tests. All right. So this lecture is suitable for students who are planning. Okay, for you who are planning to do quantitative, means that you have a questionnaire, or either you want to do experimental study. So this is lecture is suitable for you because it involves statistical tests. Okay, for those who want to explore, for example, do interview qualitative. Okay, this is not really suitable, but I hope that this can give a knowledge for you. Okay. All right. Okay. So when you planning to do statistical test, of course, okay, statistical test requires some basic information such as what is your objective of the study. Okay, what is your objective? For example, is it what I am going to do at the end of this project, at the end of this project, or at the end of my master, my PhD, what I'm going to do. Okay, so that is your objective of the study. So are you comparing between, for example, I want to compare those who are pain score between male and female. So that is a research objective. So they need a different statistical test. Or you are going to do, I want to see, is it any association between the smoking and lung cancer. So there is association. So there is also need different statistical test. So all these you must have a clear objective in your study. Second, the statistical test also depend type of variable. What variable do you have? Is it this is a categorical, or is it numerical data? Is it category or numerical data? So when you know what is your independent, what is your dependent, because different type of variable will need different statistical tests. Okay. Next, you have to know what type of analysis you are going to do. Either I just want to describe by using frequency, mean, standard deviation, percentage, or I want to see the association between one factors and the other factors, or I want to do multivariable. Multivariates means that I have a lot of independent factors that I want to study at the same time to see their effect toward my dependent variables. So this also will have different statistical tests. Type of study design. Of course, you have a study design. Either you want to do experimental study, or either you want to do observational study, for example, cross-sectional study, or cohort study, or case control, or experimental study, the best with randomized control trial, or quasi-experimental study. So this also will give you information that's, oh, I need a different statistical test. Okay, number of groups or data set. Number of groups mean how many level or how many groups I have. For example, when you talk about the gender, you only have two category, male and female. But when you talk about, for example, we talk about race, Malay, Chinese, Indian, and so on. It's a more than two category. So this will give you idea that, oh, I have to use a different type of statistical test. And then type of distribution, either your distribution normal or non-normal distribution. So if normal, okay, this is a list of statistical tests that I have to use. And if non-normal distribution, I have to use another statistical test. You cannot use the same statistical test. So all this basic information, you have to start planning before you run. However, this information maybe you cannot get after you do data collection. For example, you are planning to do multiracial, okay, Malay, Chinese, India, but at the end of your study, after you do data collection, you found that 100% or 99% is Malay. Only 1 or 2% is non-Malay. So we cannot run the analysis because even SPSS, even you can run the analysis, that is give a value, the number you get, but it not make sense in terms of comparison. So all these things, but before you start thinking about data collection, you at least you have a clear idea. Okay, what the suitable data analysis that should I apply in my project? Okay. So statistics are crucial component of research since it allow the researcher to summarize, okay, to give a descriptive, to summarize your study. How many participants involved in your study? How many male? How many female? How many working, for example, you want to take about healthcare profession. How many of them are nurses? How many of them are physicians? How many of them are dietitians? So this give you idea you about your data set. What is the average age of this my participant? So this is we call summarize. Okay, so you know that about your study in overall. Interpretation, of course, when you run the analysis, you need to interpret. Okay, you need to interpret, is it significant or not significant? Okay, and then present how you want to present in term based on the statistical test. Different statistical tests, we have different table of presentation. Okay. All right. Statistical tests can be broadly classified as parametric and non-parametric. When you hear the word parametric, mean it's a normal distribution. When we talk about, oh, this is non-parametric test, of course you straight give you a fingertip idea that, oh, this is non-normal distribution. So what is a normal, what is non-normal distribution? All right. So if you see the histogram below, this is we call histogram overlaid normal curve. You can see the histogram overlaid normal curve look like a bell. Okay, the bell so means that this is normal distribution. Okay, this is the normal distribution. They have their own characteristic, which is this is a mirror object where you draw the line in the middle. There is a mirror. Okay, so this is the bell shape. If you test your study, you get all this shape. So means your data is normal distribution. Okay, so you have to use parametric test. And then, however, sometimes your data not follow distribution or it's skewed. Skewed either to the left or to the right. How I'm going to know this is skewed to the left or skewed to the right? You have to look at the tail of the histogram of the normal curve histogram overlaid normal curve. You see if the tail longer to the left, so that is we call left skewed. So in this example, you see the tail is longer on the left side. So this is a left skewed, or we can call negative skewed. Okay. So from this is will give a different information for you. Oh, the other thing is about central limit theorem. We have another theory that we call central limit theorem. Central limit theorem said that if your sample size is more than 30, so we consider it's normal. So if you have your sample size 50, 60 and above, so we can consider is a normal distribution based on the central limit theorem. However, for me, I prefer to double check. Okay, double check with this. So it gives me a more satisfied that, oh, yes, I know my data is normal. Even I follow the central limit theorem. Okay. Next. Level of measurement. Okay, what kind of data do you have? Okay, type of data. Okay, all these things you can know when you get a questionnaire. Okay, you have a questionnaire, or if you do experimental study, you have a checklist. Okay, that need you record whatever your observation or your finding. So from that, you know already my type of data, either numerical or we can call quantitative, or the other group is categorical or qualitative. Okay, we look one by one. Okay, numerical data. Numerical data, we have two types. Either discrete and the other one is continuous. What is discrete? Discrete means you can count. Example, how many kids do you have? I have 2 kids. How many car do you have? I have 3 car. Means that you can count. Okay. When you talk about continuous, means you can measure. Okay. For example, the length. Okay. How far from Kuliah of Nursing to your house? Okay. It's a 1 kilometer, 2 kilometer, and then it can be decimal, 2.3 kilometer. Or your weight, your body weight. My body weight is 53.6 kilogram. Or it can be 56 kilogram. It can be have decimal or without decimal. Okay, temperature same. However, when you talk about discrete, it cannot have a decimal. For example, how many kids? I don't have 1.5 kids. Okay, I cannot say like that. How many half do you have? I have 3.5 houses. So it's incorrect. So that is it. However, discrete or continuous data, both are under numerical. Means that you can count and the other one you can measure. Okay. Next, we look at the category data. Category data or this one we have 2 types. The first one is nominal. The other one known as ordinal. Nominal is a name. Okay, just give a name. Example, gender, male, female. Color, blue, red, green, orange. Type of profession, lecturer, nurses, physician, and so on. Student, postgraduate student. That is a nominal data. Okay. Second is still, we give a name, but they have a ranking or you can order. For example, when you talk about the pain, mild, moderate, severe. Okay, always, usually, sometime, rarely, never. So that is the ordinal data. So this type of data, when this is even though it's a categorical or qualitative, when you want to analyze, we have to give a coding. Okay, because we don't have female, male, we do not know. Okay, which one is one, so we have to change that into a coding. Usually, when you do SPSS, we give, for example, male 1, female 2. Blue, red, do we have a number? Because SPSS cannot analyze all these categorical data without we give a number. Good. So this type of data will determine what suitable statistical test for your study. So if you have clear this one, so it is a good. Okay. Okay. Now we move into choosing, or this is just general guide for you, okay, to select appropriate statistical test. Okay. First, there are group. If you see on the first column, okay, number of group, we have two, independent or dependent. What we means by independence means that you only take the participant information or you do the study only one time. Okay, but when you talk about dependence means that you have to take the information or you do a questionnaire 2 times, means that you have pre and post. Okay, this is suitable for those who do a intervention study. Of course, you want to see what is the effectiveness of your intervention. Of course, you have to take the baseline information, mean pre the intervention. After that, you measure the same participant after you do the intervention. So that's one we call dependent. If your study just give a questionnaire or the participant only needs to answer your questionnaire once, so that one we call independent observation. Okay. So, and then of course, independent and we also have dependent. Independence mean the factor. Okay, what are the factor? What are the independent variable that you want to see? And then when you talk about dependent is the outcome, what you want to measure, what you want to look at. Okay. So of course we have parametric means it's follow normal distribution and non-parametric means it's non-normal distribution. First, I have 2 groups. Okay, my group is independence, means that I only give my questionnaire once. Okay, my participant, I didn't do the any intervention. Okay, I don't have pre and post. My participant only you go to the population, you give your questionnaire, and then you collect. Okay, so that is we call independent. If I have categorical, for example, I have only two group, smokers versus non-smoker. Okay, I have one smoker group, the other is non-smoker group. My dependent, I want to see either smoker or non-smoker, which one will develop coronary heart disease or no coronary heart disease. So my dependent is also categorical. So categorical versus categorical, my independent is categorical, my dependent is categorical. So I have to use the test known as chi-square test. So your independent categorical, my dependent also categorical. So I have to use chi-square test. If the assumption for chi-square test is not met, so I have to choose a Fisher exact test. Okay, all right. Next, I have two category, still the same. My category, I have two groups, smokers and non-smokers. But now my dependent is numerical data, which is I measure the blood pressure. Okay, so if my finding is a normal distribution, so I have to use independent t-test. If I check the assumption is the non-normal distribution, so I have to use Mann-Whitney test. So this is what I informed you earlier. The type of data will determine which statistical test that's suitable for your study. Okay, so this one for only two groups. Okay, now I move to the other one is what happen if I have more than two groups. It's still independent, but it's more than two groups. Example, I have a categorical data, but I have more than two. I have Malay, Chinese, Indians, mean that I have three. But, and then my independence still, I want to see only two group, diabetic and non-diabetic. So for categorical, we still use chi-square test. So doesn't matter how many groups, categorical, so you have to use chi-square test. Okay. Now, what happened if I have more than two groups and now my dependent still numerical, my dependent is numerical. So now you cannot use independent t-test because for independent t-test, categorical only two. But now I have more than two. Okay. I have more than two groups. Okay. Malay, low, medium, high economic status. I have three category. And then my dependent is blood sugar level, which is numerical. So I have to use now one way ANOVA. If my data is non-normal distribution, I have to apply Kruskal-Wallis test. Okay, so remember, if you have only two groups, so if your data is categorical, you have there is a standard which is my independent is categorical, my dependent categorical, so I have to use chi-square test. But if my independent only two groups, so I have to use either independent t-test if normal assumption is met, and then I have to use Mann-Whitney if my data is non-normal distribution. However, if I have more than two, okay, I have three groups. Okay, low, medium, high. So my dependent numerical. So rather than independent t-test, I have to use one way ANOVA. If the assumption for normality not met, so I have to choose Kruskal-Wallis test. Okay, so this is a basic. Okay, now we look. I want to do the intervention study. I want to do experimental study. You want to see, for example, this class, before I give you lecture, I get your baseline about the knowledge score. And then I deliver a lecture. After that, I ask you the same question to see pre and post. Means I do something. I do intervention. Okay. All right. For categorical, if involve pre and post, okay, and then the for dependent or the outcome you want to see also categorical, so that test known as MAGNIMA test. Okay, I have categorical data, okay, pre-exercise versus post-exercise. I want to measure their blood pressure. Is it any difference or not? So if data normal distribution, I have to use PET test. While if data is not normal distribution, I have to use Wilcoxon sign rank test. Okay. Next, we have to, what happen if my data are both numerical? My independent or numerical, my dependent also numerical. Example, the height, the weight, okay? So in this case, if you want to see correlation, if normal distribution, you can use Pearson correlation. Or another statistical test that you can use is simple linear regression. If non-parametric test, you can use Spearman correlation while still simple linear regression even though it's a non-para. What is the difference between peer correlation and regression? Correlation, you just want to see the association. What is the strength? Okay. However, when you talk about simple linear regression, if you have a good study design, means that you're able to do prediction. Okay, student, do you understand or do you have any question? Do you have any question? Okay, no question. I proceed. Okay, I assume that you understand. All right. Okay, next. Now we go example detail for each one. Okay. So there is a question. Is there a significant difference in the average test score between students who receive a traditional teaching method and those who underwent a new experimental teaching method? First, you have to know which one independent variable, which one is dependent variable. Okay, if you look here, the first question, is there a significant difference in the average test score between students who receive traditional teaching method and those who use the new experimental teaching method? Which one you think is independent? Which one you think is a dependent? Can someone just type in the chat? Anyone know the answer? Which one is independent? Which one is dependent? Independent type of student. Okay. Who else? Thank you, CB, for respond. Experimental dependent. All right. Okay. What else? Any other student want to answer? Which one is independent? Which one is dependent? Because this is important for you to determine which statistical test. All right. Teaching method is independent. Yes. Okay. Thank you, Saidi. Thank you, Yunus. All right. Okay. When you look here, independence is the teaching method. Okay. Average score is the dependent. Yes. Okay. IV is type of teaching method. Yes. DV is average test score. Yes. Good. Okay. That is a correct answer. Okay. You look here. We want to see the test score. Okay. The test score is our dependent. Okay, score means of course is a numerical data. So test score is our numerical and then is my outcome. I want to see if I use the traditional teaching method, is it the score still high or low? What is the average score that student get? I want to compare this traditional teaching method with new method, new experimental method. So I want to compare those two groups using traditional and using the experimental. towards the outcome, I want to see their test score. So test score become the dependent. Now the teaching method, either traditional or experimental new method. So that one is the independent. Okay, I hope you understand, you're able to differentiate. Okay. Okay. Second, we look at the second question. Are there significant variation in the mean income level between two cities with different economic development strategies? You look here, I want to see the income level, mean income level. When you get the word means that is a numerical data because you can find the mean, okay, the average of the income. So this is the numerical or the output, okay. And then you want to compare between two city A and city B. So these two city become the independent variables, means that the income level is dependent. Okay. From this, okay, they didn't do any intervention, they just do observation. So we look at how many group the independent. We have only two group, okay, which is categorical. What mean categorical? We have traditional teaching method, one group. Another group is new experimental teaching approach or teaching method, new method. So you only have two group, which is categorical. Group 1, those using the traditional method. Group 2, you have a new method. And then the dependent, which is the test score, is a numerical data. Okay, 20, 100, 100 or 80 or 60 is depend. So that one is numerical. If I check my data, okay, my data is normal distribution, so I have to use independent t-test. If my data is non-normal distribution, I have to use Mann-Whitney test. So different type of data and different in terms of normal distribution will give you different statistical tests. While doing your project research, if you have wrong statistical test, means we can consider half of your study is wrong. So that's why for those who want to do quantitative, you have to make sure that you using or you apply a correct statistical test. Okay, next. Now, next question. Is there a statistically significant improvement in the average performance score of students before and after they undergo a specific tutoring program? Question another. So here, from this, you see the word before and after. Means that before you want to do a program, which is you do a tutoring class. Of course, you want to measure before and after score. So if there is keyword pre and post, before and after, and then you want to see in terms of score, performance score, which is this one is dependent. So categorical is before and after, okay. And then dependent is numerical score, which is the performance score of the student. This is only have two group. If data normal distribution, you have to use PET t-test, while if data non-normal distribution, you have to use Wilcoxon sign rank test. Okay. Same with the second question. Does a new drug lead to a significant reduction in blood pressure within the same group of patients? Remember, pre and post means that the same participant you measure. You cannot measure, you go to a year 1 student and then you do intervention but you take the post for year 3. It's not correct. Okay, so the same participant have to answer your questionnaire. Okay, pre and post. So the company give you a new drug. Of course, you want to test. Before you test the effectiveness of new drug, you have to take the baseline blood pressure first because you want to compare. If you didn't take the initial or the baseline, how you want to know this drug is effective or not? Okay, so they have pre and post measurement of blood pressure because you want to see is it new drug effective or not. Alright. So means that the blood pressure, which is numerical data, of course you have a two group, pre and post, which is categorical. So we can use parity test is normal distribution. Non-normal distribution, we have to use Wilcoxon. Okay, clear or not? Do you understand? Any question you want to ask? If no, okay, I just proceed. Okay, anything, just type in the chat. Okay, all right.
Doctor,
Yeah,
just one question.
yeah,
So this means that every time after we collect the data,
yeah.
we have to check for the skewness, right?
No, that is a final stage.
Oh, I see.
Yeah, you finish all the data collection first and then you check because analysis have to done after you finish.
Yeah. I mean, after I receive all the data,
Yeah,
I have
okay.
to calculate the skewness in the data, right? In order to differentiate between normal distribution or skewed.
All right. There are another option which is in the while checking using the petty test, there is a checking assumption for normal distribution. So
Okay.
sometimes you no need to check for normal distribution overall because each test also have their own checking for normal distribution.
Yes, doctor. Thank you.
All right. Okay. All right. Okay. Next. Okay. Now we move. Okay. We move to categorical versus categorical. Example, do smoking habits, smoker and non-smoker, okay, differ significantly among individual with family history or without family history. You want to see the smoking habit. Those who are from either, so smoking habit, you want to see, of course, this is the outcome. Okay, this is the outcome I want to see. Either they are smoker, become smoker or non-smoker. I want to see, is it what are factor? Is it family history can influence their smoking habit? So family history is independent variable. Of course, family history is what's in this example is a category. Presence of family history and no family history. The outcome is smoker and non-smokers. Okay, this is also category. Number two, is there significant association between level of education, high school, college, and graduate student to voting preference? Either they want to choose candidate A, B, and C. Here you can see that it is now more than two category. So for chi-square test, if you have categorical versus categorical, and then there is only no intervention, no pre and post, so you can apply chi-square test. If the assumption for chi-square test is not met, so you have to choose Fisher exact test. Alright, so this is for categorical. So categorical is easy because either two groups or more than two groups, you have to apply chi-square test. Alright, there is a difference between two groups or three groups in the when your outcome is numerical data. Okay, next. Is there significant change in the number of individuals who prefer product A before and after a marketing campaign? So of course, they want to see is it they will use, they are prefer product A or not. So that is the outcome of the study. Okay, they want to choose either the participant, either they will buy the product A or not, or either they like it, the product A or not. So you have a categorical marketing campaign. Of course, you have to see pre and post. So this one automatically you know, oh, categorical, and then I have pre and post. So the test known as McNema test. Okay. Another question. Is there a significant change in the number of individuals who report experiencing a specific symptom before and after a medical intervention? Pre and post, you see, before and after. Okay, the word before and after give you idea that, oh, I cannot use the chi-square. Why? Because now I have pre and post. I have dependent observation. And then present of the symptom, either the participant experience or no experience of those symptoms. Yes or no. Okay, so there is also categorical. So the suitable statistical test for pre and post categorical data, we have to use MAGNIMA test. All right. Okay, next. Okay, now we have a research question. Do three different teaching method. Okay, either traditional lecture, group discussion, or online learning. Okay, this is the factor you want to see. Which one have significantly different exam score? If the student attend traditional lecture, you compare with the group discussion, you compare with another group which is using the online learning. At the end, you want to see what are their exam score, which one is effective, and so on. So now, you have three groups, mean then more than two method. Traditional lecture 1, group discussion 2, online learning. So, and then my dependent is numerical, which is exam score. So, if data normal distribution, you have to use one-way ANOVA. If data non-normal distribution, you have to use Kruskal-Wallis test. Okay. Same with the second question. Is there significant difference of mean response time to stimulus among individuals who receive placebo, a low dose of drug, moderate dose, or high dose? Here you can see the independent variable. We have more than two groups. Now is a four. Placebo, low dose of drug, moderate, and high dose. So we have four groups. You want to see is it any difference in terms of mean response time? So my independent, I have four, which is category. I have group placebo, low dose, moderate, and high dose, four groups. And then my dependent is numerical because I want to see the time response. Is it 30 minutes or is it second? You have to set that one, okay? It must be standard. If you want to use a second for all, the response must be in second or hours, okay? It depends to the study. So if you look here, so if data normal distribution, I have to use one-way ANOVA. If data non-normal distribution, I have to use Kruskal-Wallis test. Okay. Alright, now we finished about very simple, or we can call univariate. What mean univariate? You only study one factor at the same time. Okay, one factor at one time. Okay. Now, before we move to multivariates, do you have any question about univariate? Do you have any question? If no question, okay, no. All right. Okay, thank you for respond. All right. Okay, now we move to multivariate. Multi means more than one. Okay, this is what we call multivariate. Okay. Usually, okay, for master level or PhD level, we advise students to do multivariate. Because when you talk about univariate, okay, independent t-test, one-way ANOVA, what correlation, regression, simple linear regression, that one is suitable for undergraduate student. Because for the basic, they learn that undergraduate. Except you do an intervention study. Okay, your method is you do interventions, mean more complex or compared to the undergraduate student. They give a questionnaire, just run very simple. But for those who didn't do observation or who didn't do experimental study, or any intervention study. So if you just use questionnaire, so we are advise you to use multivariate. Okay, this is level for master and PhD. Okay, what is multivariates? Mean that we have multiple. We have many factors that we want to study at the same time. Okay, we look one by one. Okay, number of dependent variable. Number of dependent. Now I have one or more than one. For example, you talk about the independent t-test previously. It's only have one outcome. Okay. However, multivariates, okay, we talk about still one, but independent is more than one. Okay. First, your independence variable, you look either numerical or categorical. Example, you want to study the age. Age is a numerical data. And then at the same time, you want to study a gender. Male, female is a categorical. Now you have two independent variable. So you want to run at the same time. So that one we call multivariate. Okay. So independent variable can be numerical and categorical. But your dependent now numerical. Your outcome is numerical data. So you can use multiple linear regression. This is very familiar and very famous among the PG student. They use the multiple linear regression if their dependent is numerical. Okay. So now you look, the difference is between the dependent variable will have you different statistical tests. That's why I said before, type of data or dependent variable or independence is very important because it will give you a different statistical test. Okay. Now, you either the independence still numerical and categorical, okay, or if you have only numerical, is also okay. All right. Okay. You have numerical and categorical. Now your dependent is categorical, but with dichotomous means that you only have two groups. For example, presence of disease or no disease, healthy and sick, prefer and not prefer. Okay, you only have two groups, dichotomous, so you have to use multiple logistic regression. Now, what happens if I have more than two groups? Okay, if I have more than two groups, for example, you want to know about what at the end of the student, what student prefer to choose, become a nurse or become a physician or become a pharmacist. Okay, so there are more than two groups, more we can call polytomous. So now so now you have to apply multinomial logistic regression. You cannot use multiple logistic. Why? Because my outcome now is on more than two groups. Okay. Next, time to event. You want to see the survivor. Okay, example. How did people know about the survivor of those people patient after diagnosed with the cancer? So after diagnosis, the event you want to see either they still alive or dead. So time to event. Okay, you want to see how long they survive. So in this case, you have to use proportional hazard regression. Okay, time to event. This is one of the survivor analysis. You want to see the survivor time. Okay. Next, I want to use two categorical. Now my independent, I only have two. Okay, for example, you want to study about gender, male, female, and at the same time, you want to study about the race, Malay, Chinese, Indian. I have only two category. My dependent is numerical. Okay, if you use oh, I think this is wrong. Okay, sorry. Let me add. This is a spelling error here. Wait. Okay, this spelling error here is to be two-way ANOVA. Okay, one-way ANOVA only for one factor, one category. Now we have two factor, which is now become two-way ANOVA. Okay, it's it's a spelling error here. Two-way ANOVA. So two-way ANOVA means you have two independent variable which is in category. If you only have one factor, that one we call one-way ANOVA. So one-way ANOVA is one factor, is under univariate. But now you have more than one, you have two factors which is categorical. So you should apply two-way ANOVA. What happens if I have three or more than that? So for three and more categorical, now you want to study more than two category. So you have to apply multifactorial ANOVA. So the test known as multifactorial ANOVA. So for multifactorial ANOVA, here is all categorical. But if you have mixed with the categorical variable, you means that you have numerical, so the above statistical test is suitable. Okay, this one for only categorical. You don't have any numerical independent variable. Okay. Next, you have categorical, but you control the covariates. Okay, later on I will explain the example. So the suitable statistical test is known as UNCOVA. Okay, UNCOVA. Alright. Now, your independent is categorical, and then your dependent is numerical, but you repeated. You do. After 1 month, you want to measure again the blood pressure. After 2 months, after 6 months, after 1 year. Means that you repeated the same thing. Okay. So known as a repeated measure ANOVA. If you only have one time, so that one you go back to univariate pre and post. Pre and post mean one time only. But if you repeat more than once, so we call it repeated measure ANOVA. Okay. And then for categorical, you have another variable which is you want to control that variable because this will influence your data later on. And then your outcome numerical, we call that statistical test a repeated measure UNCOVA. Okay. Now, I have more than one. Okay, I have more than one category in terms of dependent. Dependent variable, I want to see either you want to look at the blood pressure, my outcome. Another one, I want to look at the heart rate. So you measure the outcome more, your dependent now become two. Okay, more than one, doesn't matter, three, four, and so on. So if I have categorical, my dependent is dependent and but have more than one. Okay, I have blood pressure. At the same time, I want to see the heart rate. Okay, so the suitable statistical test known as MANOVA. If I have the presence of covariates, mean that I want to control that one, now the test become MANCOVA. Okay, let us see each one of the tests. Okay, this is question. Can we predict the exam score? Okay, exam score, you want to see which is your dependent based on the student's hours of study per week, attendance, and gender. So now, other than you have one variable, you want to see three variables at the same time. This statistical test means that you put all these three variables at the same time. Now I have three factors or three independent factors, which is hours of study, attendance, and gender. So I mix between hour of study, which is numerical. Attendance, maybe how many, the frequency, which is the numerical. And then I have gender, which is the categorical. So the important thing you have to know the dependent, which is now the exam score, which is the numerical. I have only one dependent. I want to see only exam score. Okay, my dependent is numerical. My independent variable is mixed between numerical and categorical. So the suitable statistical test is multiple linear regression. Same with the second question, daily cigarette consumption. Is it 1, 2, 3, 4, 6, 7, 20, and so on? Can be predicted based on the smoking duration, age, income, and gender. Now I have four independent variables. Smoking duration, how long these participants smoke. Age, when they start smoking. Income, gender. And then it's mixed between numerical and categorical. And then my outcome, which is I only have one, which is I want to see cigarette consumption, which is numerical. So in this case, I have to apply multiple linear regression. Okay. Next. Can we predict the likelihood of a student pass or fail a course, okay, based on the variables such as study hours per week, attendance, gender, and priors GPA? So you want to see the student, the outcome is pass or fail. Now I have the dependent only one. I want to see the student either pass or fail. So only one category. And then it's a categorical data, which is I only have two. Okay. Uh, Pass or fail. So there is only two category. And then my independent variable, I have more than once. I have studies hours per week, attendance, gender, and GPA. Okay, so I have four independent variable: study hours, attendance, gender, and prior GPA. So in this case, I told you look at the dependent variable. If you want to do multivariates or multiple analysis, you have to look the outcome. First outcome, pass or fail, which is this is categorical, but only two groups, dichotomous or binary, we call that. And then your independent must have more than one. So this in this case, I have to use multiple logistic regression. Same, okay. Can we predict the likelihood of a patient developing diabetes or not develop diabetes? Okay, means that presence of diabetes or no diabetes, binary outcome or dichotomous. So yes or no, presence or no diabetes. So you only have two category, two group, present or diabetes and no diabetes. So in this case, okay, you know already, oh, this is categorical, and then I only have two groups, and then my independent is more than one. I have age, which is numerical, family history, which is categorical, and lifestyle choice, okay, should be categorical. So means that the suitable statistical test is multiple logistic regression. All right, any question? Any question? No, doctor. All right, thank you. Okay, if no, shall we stop for 5 to 10 minutes because it's almost 50 minutes already. Can we stop for a while? We just take rest for 5 to 10 minutes. All right. Okay, thank you. So we continue at 9:30. Okay, sharp 9:30. We will continue. Okay, we just take rest for a while. Okay. Okay. All right. Okay. We continue. Okay. We coming back. Okay. Welcome back to all. All right. This one we finished already about the multiple logistic regression. Okay, now we see. Okay, research question. Can we predict the political affiliation, either Pakatan Harapan, Perikatan Nasional or MUDA, of individual based on variables such as age, income, and education level? We want to see the independent now. Okay, you look at the outcome. The outcome is we have more than two groups now. Either the participant we choose Pakatan Harapan or Perikatan Nasional or MUDA. Now we have three groups, means that more than two. Okay, and then we have the independent variable. We have age, income, and education level. Okay, so for this one, you have to use multinomial logistic regression. Remember, we only have one dependent variable, which is the political affiliation. And then want to see the independent. Now we have more than one: age, income, and education level. So in this case, we have to use multinomial logistic regression. Is this a categorical, but it's more than two? Okay. Second, does the choice of transport mode, either personal car, bus, or Grab? Okay, now you have the categorical, but it's more than two. You have personal car, you have bus, or Grab. Okay, depends on variables such as distance to work, household size, and income. So now I have one outcome only I want to study, which is the categorical, but it's more than two. We call polytomous: personal car, bus, or Grab. And then my independent, which is the distance to work, household size, and income. So in this case, I have to use multinomial logistic regression. Okay, next. Is there a significant difference in the response time among the participants exposed to different lighting conditions? Okay, now we have two factors, either factor A and factor B. So in this case, you look, my independent variable is a response time, which is numerical, and I only have one independent only. I want to see only response time. But my independent now, I want to see two factor: factor A and factor B. If you just want to see factor A toward the response time, so you have to use one-way ANOVA. But now I have more than one. I want to see factor A, either natural light or artificial light, and different noise, either quiet or noisy. So these two factors, I only have one dependent, which is response time in numerical. So I have to use two-way ANOVA. Okay. Next, does the exam score, means the dependent variable exam score, significantly difference based on the both teaching method? Either the factor A is traditional and online, or the type of assessment, exam or project. So I have one dependent variable, which is the exam score, but I have two independent variable, which is factor A and factor B. So I have to use two-way ANOVA. Okay. Next, is there a significant difference in the test score? Okay, I only have one dependent variable, which is test score, which is we measure in terms of numerical: 100, 70, 80, 85, 89, and so on. And then now I have more than two factors, the independence, either factor A, factor B, and factor C. Different teaching method: method X, method Y, and method Z. Another factor I want to see that at the same time is different type of school: public, private, or charter. And then socio-economic status also I want to see: low, middle, or high. Now I have three independent variable, which is in term of categorical. My dependent is one outcome, which is measure numerical. So in this case, I have to use multifactorial ANOVA. Okay, because I have more than two. Okay. Is there a significant difference in the sales performance? Okay, sales performance, how many the participant, okay, able to perform, able to sell their product in terms of different marketing strategies. This is a factor I want to see. Either factor A, they use strategy X, Y, or Z, in terms of region, north, south, and east, or based on the time of the year, Q1, Q2, Q3, or Q4. So now I have three factors, which is the categorical, and then I have only one outcome or one dependent, which is numerical. So in this case, I have to use multifactorial ANOVA. Next, does the effectiveness of a new drug, factor A, which is drug A, drug B, in the reducing the blood pressure when taking into account the initial blood pressure level patient as a covariate? Okay, here the presence of covariate. Okay, what we means by covariates? Covariates means something that can affect, okay, the your study. Okay, for example, you want to study the effectiveness of new drug. Might be the initial blood pressure level of patient can influence. Okay, the reducing blood pressure. So you want to control that one. Okay, you want to control to make sure that uh you will compare fairly, okay, without taking consideration of initial blood pressure level. So if you have this covariate, so means you have to use uncover. If you don't have any factor you want to control, so you cannot use uncover, you have to use different statistical tests. Okay. So next question, is there a significant difference in terms of job performance score? Okay, so your job performance score is your dependent variable. You only have one. And then it is a numerical data. Okay, and then among employee who underwent different training program X or Y, you control their initial job performance score. So because we believe that the initial job performance score will affect, okay, the effectiveness or the performance score later on. So we want to control that one. So that one known as covariate. You cannot control the participant because they already have that one. For example, initial blood pressure, they already attend the initial job performance, they already get. However, we can control through statistical tests. Okay, this one, when you run the uncover, you know that is a where you can control this. So this is a beauty of statistical test. You cannot control in the real setting, but you can control that in terms of data analysis. Okay, next. Is there a significant difference in anxiety level across 4 consecutive weeks among participants receiving different treatments? You want to compare treatment X, Y, and Z. And then you want to see the outcome is only one, which is you want to see the anxiety level. So anxiety level is a numerical data, only one outcome, but you want to repeat for 4 times. Maybe week 1, week 2, week 3, or week 4, or maybe 1 week, 1 month, 3 months, or 4 months. It depends your type of study. So in this case, the dependent is numerical, independent is categorical, but you want to repeat. Okay, so that one we call repeated measure ANOVA. Okay, repeated measure ANOVA. If you only 1 week you want to do, so just go to the basic, which is pre and post. So that one is pair t-test. So if you repeat more than one time, so that one is repeated measure ANOVA. Okay, so week 1, week 2, week 3, or 4. Treatment type, okay, either treatment X, Y, and Z, and then anxiety level, which is your dependent. Okay, I only have one outcome. Okay, which is we want to see the anxiety level, but different timing. So this is a repeated measure ANOVA. This is usually for those students who will do the experimental or intervention study. You want to see the difference between the time, okay, and so on. Okay, next. Do different drug therapies result in significant difference in pain relief over time while accounting for initial severity of pain reported by the participant? Here, initial severity of pain become the covariate. Means that you want to control that one because it might be affect the drug therapy, the pain relief among the participants. Okay. So we have time frame which is pre-treatment, post-treatment one or post-treatment two. Okay, they have three things. And then drug therapy between X, Y, and Z. So initial pain severity become the covariate. If you want to control something, the factor that can affect your study, so that one we call covariate. Of course, you cannot use ANOVA, repeated measure ANOVA, but now repeated measure ANCOVA. The difference is depend to your data. Is it that factor significant effect toward your outcome? So if you say yes, it might be have. So you want to control that one. So now it's become repeated measure ANCOVA. If you see the factor are same, you say no, it's not effects toward the treatment. So means that you no need to do ANCOVA, but you can do repeated measure ANOVA. Okay. All right. So for multivariate, it is quite confusing. But if you clear the dependence, the independence, so inshallah, okay, you will have a correct statistical test. Okay, so next, what factor influence the survival time of cancer? So time to event. Okay, this usually some students or some patients just refer to record. Okay, record in the ward. Okay, because if you follow up now, okay, we do not know either the patient will survive or not, or if not, maybe you die first before them. Okay, so usually when you talk about the survivor, they look at the record. Okay, so record in the hospital, you want to see the patient either from maybe from 2000 until 2025 within 5 years, okay, into 2000 who had been diagnosed with the cancer. So you see the cases in the ward, or maybe some of them discharged already, maybe some of them die in the ward, or maybe some of them die in the at home, and so on. You still have contact number, you can call them. So usually it's depend on the record. Okay, so what factors influence the survival time of cancer? The outcome is time to event, survival time after diagnosis, example. So the independent variable, maybe you want to look at the age, treatment type, tumor size, or comorbidities. So the independent variable should have be more than one factor. Okay. So independent can be numerical and categorical, but I only have one dependent variable, which is survival time to of cancer, which is time to event. So the statistical test that you should use is called proportional hazard regression, which is one type of the survival analysis. Okay, next. Do different exercise program, aerobic, strength training, flexibility, lead to distinct changes in multiple physical fitness component. For example, cardiovascular endurance, muscle strength, and flexibility. You look here, now your outcome you want to see physical fitness component. Physical fitness component you measure into more than one group, one dependent. You want to measure cardiovascular endurance, you want to measure muscle strength, you want to measure flexibility. Now the dependent variable is more than one as compared to previous that we discussed. Okay. And then you have the different program, which is aerobic, strength training, flexibility. So in this case, your dependent is numerical, but more than one category. Independent is categorical, so you should use MANOVA. Okay. And then if you have presence of control covariate, for example, do various intervention program, mindfulness, counseling, support group, have differential effects on psychological well-being, For example, anxiety, depression, life satisfaction while accounting for participant baseline stress level. You feel that the participant baseline stress level will affect, okay, your intervention program. So you want to control that one. As I mentioned, you cannot control in a real setting, but you can control in terms of statistical analysis. So your psychological well-being indicator become your dependent variable. Okay, intervention program, which is you have independent, and baseline stress level is become the covariates rather than use MANOVA. Now you have to use MANCOVA. All right. Okay. We already finished. We cover already multiple multivariates or many factors. Either independent variables, you have a lot of factors, or you can have also dependent, which is more than one group. For example, in case of MANOVA and MANCOVA. Okay, do you have any question? Any question? Okay, no. All right. I hope that all of you are clear. Okay. All right. Okay. Thank you for respond. Okay. Okay, now we talk about the software, okay? We have a lot of software in the market, okay? That are very common or very friendly user, which is the SPSS. Now I think we have SPSS version 31, okay? So this is very friendly user. However, each software have their own weakness or their own limitation, okay? So, okay, for SPSS, it's a really friendly user. I hope that you are familiar with that. Okay, and then we also have Stata. Okay. Attendant link, please. I do not know. The attendant may be under the control of CPS. Okay. All right. Okay. And then the starter is another software, which is this one. You have to know how to write the coding. Okay, the instruction. Okay, it's a good starter or also not what the if you know the command, okay, to put in the starter ni it's okay, all right. So and then we have now Art Studio, which is free. Okay, starter you have to subscribe, same with the SPSS. And then if you another thing is Amos. Okay, Amos is more to graphic. For example, if you want to see the validation of the tools, for example, you want to see the questionnaire. When you want to see is it this questionnaire really measure what's supposed to measure. For example, you want to see the knowledge. What is the item in term of knowledge? Because this thing you can is easily using the Amos because it give you a view. Okay, for example, this one you can see the picture. Okay, so for item knowledge, for example, they have 12 questions. But after you run the analysis, you found that knowledge, attitude, and practice, some of them maybe you develop a new questionnaire based on your literature search, based on your reading, based on your discussion with your supervisor, and so on. So we found that some of the item overlap, maybe it should be removed. So the Amos is very suitable, and I also encourage you to use this software for use for those students that you want to do a validation study. You want to either you want to develop a questionnaire using the exploratory phase or confirmatory phase. Okay, so Amos is suitable. Another software is a SAS. Okay, so this is the software that available that can you apply, okay, that or you can use in term of your data analysis. Is depend to what type of analysis you want to do. All right, it is depend to you. Okay. Okay, as a conclusion, okay, we almost at the end, okay. So the best time to plan the analysis is before collecting the data. During your proposal, preparation for proposal, of course, I believe you have to prepare the proposal with the introduction and then a literature review and then in terms of methodology. So in terms of methodology, you know already. If if I want to do a study about I'm using the questionnaire, of course I must get the questionnaire first. From the questionnaire, I can see is it numerical or is it categorical data. It's give you idea already. And then you want to see how many factor I want to study. Is it one or multi? If multi, oh, I have to use multivariate. I cannot use univariate because this is multi. And then outcome. Is it my outcome? I have one outcome or two outcome? Or is it my dependent, or is it numerical or categorical? Because the different type of dependent variable, we use the different type of statistical test. So for those who want to use the quantitative, especially using the questionnaire, look at the questionnaire. Okay, look at the questionnaire. Is it numerical or is it categorical? So this will give you idea to select the correct statistical test. Okay. And then for those, I do not know your background and so on, but for those who want to do intervention, you want to do something, you want to do intervention, you want to do experimental study, you no need to go for advanced or multivariate. Just enough to use the basic, because you want to see the pre and post. Except you repeat for few times, okay, several time at different time, 1 month, 1 week, 1 month, after 2 months, what happened to your intervention, that one you have to use using the repeated measure. So it depends what is your study design. Okay. Selection of wrong statistical tests can lead to false conclusion, which can compromise the quality of research. Similarly, a wrong interpretation also will lead to a wrong conclusion. So means that you have to really select the correct statistical test. Okay, to you have to know, you have to aware that assessor is usually they choose the assessor who are knowledgeable with the statistical test. So you have to use the correct one. Wrong statistical test, we have a wrong result and so on. So I'd say that might be you we get measure, you need to rerun the analysis and so on. So before that, during prepare the proposal, you already clear idea why, and then you have to ask why I choose this statistical test. For example, I want to choose multiple linear regression. You have to ask why I have to use multiple linear regression. Is it my data suitable with not, and so on. All right. Sometime we during proposal, you want to do analyze this, but after data collection, maybe the data is not suitable. That is a different story. Okay, but at least during the proposal defense, you already clear what you are going to analyze your data. Okay, so as a conclusion, the statistical part is very important. Okay, for you in term of your study. Okay. Next. Okay, okay. I want to promote. Okay, we have biostatistic workshop, which is we will teach you how to analyze using univariate analysis, which is next week already. So it's cover the topic introduction to statistic, SPSS, descriptive and data management, independent t-test, Whitney, one way ANOVA, Kruskal-Wallis, pair t-test, Wilcoxon, categorical correlation and simple linear regression. This is what topic all the topic cover for univariate analysis. So for those who are free or interested to join, you can scan for registration, okay, to enhance your knowledge. I think with that, thank you. I didn't know. Okay, do you have any questions? Do you have any question you want to ask?
So
All right.
far, so good, Doctor.
Huh? So far so good. Okay, Alhamdulillah. All right. So that bus is online or physical course. It can be both, either physical or online. You can choose. Okay, thank you. I really appreciate. Okay, I hope that what I deliver today is a benefit for you. Familiar with interrupted time series. Okay. Yes. Okay. Because time series you have to go for the survivors. Okay. It's very clear cut. Okay, thank you so much. I hope that what I deliver today is a benefit for you. And then I wish you all the best. Okay, all the best in your journey. Okay, I think it's still long. It's a long process. Master or PhD is not a simple. Okay, so please focus. Even there are, study, especially for those local. Okay, you study here. There are a lot of challenges that you have to face. Okay, in terms of family, in terms of time, while you are working, or I do not know either you are full time or part time. I just wish you all the best. Remember. There are many students want to join this PG, but you are being selected. Means that Allah select you already. So means that you can do that. Okay. So I wish you all the best. Okay. Thank you very much. Assalamualaikum. Alright, okay, so I will leave now. I leave now. Alright.